I am Christy, and I'll be the circulating nurse for Mrs. Holmes today for her surgery. At this time, I will take a look into her medical record to review her chart and pre-op information, just to make sure we have all the necessary information prior to surgery and address any pertinent concerns. Okay, so I'm just trying to open the chart for her medical record right now. Just bear with me, okay? So the type of surgery that will be performed is a surgical repair of a displaced metatarsal fracture on the left foot, which is actually the first metatarsal bone, which is behind the big toe. The doctor is Dr. Yeshua, and skin prep with HCHG wipes has been performed by the nurse upon the patient's arrival. The surgeon has completed his H&P, history and physical examination findings. This is great. As far as the previous medical history, there's no hypertension, diabetes, or cancer. So the medical history looks great. Prior to previous surgical history, there's no previous surgery. This looks great. Allergies. So the patient is allergic to penicillin, it breaks out in hives. Pollen. The patient is allergic to pollen, which causes the skin to itch. The pollen in the eye causes the eye to swell. Benadryl helps with it, or taking a shower to get the pollen off the skin also helps. The patient uses honey as a preventative. The patient is also allergic to pineapples. It causes an itchy tongue or ulcers in the mouth. If it's a severe case, it results in hives. The patient has no allergies to latex. This is great. If anything, I will relay this information to the surgical team, and if we can use any alternative methods or materials, this will be communicated. No previous surgeries, no presence of metal implants. The patient has never been under anesthesia. This will be their first time. However, there is no family history of sensitivity to anesthesia. The patient does not have any prior or pre-admission prescription medications. The patient does not use any illicit drugs. For herbal supplements, the patient does drink a herbal detox drink. And over-the-counter drugs include a daily woman's vitamin, turmeric, and ginger tablets. And it looks like the patient takes Benadryl as needed for allergies, but this has not been taken recently. So everything looks good with pre-admission history. Let's take a look at the patient's labs. All electrolytes are within normal limits. The BU and creatinine look good. The surgeon has put in orders for HCG test, and that has been performed, and it is negative, so that is great. The proper diagnostic tests and x-rays have been performed. Everything checks out well, and if there were any known results, I will communicate this to the surgeon and or anesthesia provider. So I have verified that all preoperative orders are completed, including all preoperative medication was administered at the appropriate time. All right. The patient has also been NPO since midnight. The patient was wiped with CHG this morning when they arrived. Everything looks good regarding our pre-op information as needed. I will now head to the patient's room to talk to the patient. You want to adjust it, and then I'll just you want to adjust it. Yeah, get the roller right. Sorry. Come in. Hello, Doctor. Hello, Mrs. Holmes. I'm Christy. I'll be your circulating nurse today. How are you? Good. How are you? Good. Today you're here for surgery, is that correct? Yes. Okay. Just perform some hand hygiene. I'm just going to close your door for patient privacy, okay? Okay. Okay. All right. And can I get you to verify your name and can I see your wristband? And can you verify your name and date of birth? Just going to check it against the medical chart. Yeah, Tiffany Holmes, 5898. All right. Thank you so much. Can you tell me what type of surgery you're having today? I'm having a surgery of a displaced metatarsal on my left foot. Okay. And it was a fracture, is that correct? Mm-hmm. Okay. Can I take a look at that? Mm-hmm. And it's is it the first metatarsal? Is that correct? Mm-hmm. Okay. All right, I see where the surgeon has signed his initials, so that's good. So the surgeon has already been in to see you? Yes. Okay. And what about the anesthesiologist? Have they come to? Yes. All right. Oh, just look at some other things here. And I see in our chart that you are allergic to penicillin. pollen and pineapples. Is that correct?
Yes.
Okay. And then for the penicillin, we have a Hobbs reaction. For pollen, the skin itches, and you take Benadryl, and that usually clears everything up.
Yes.
Okay. And for the pineapples, itchy tongue, cause hives if it's severe.
Well, ulcers.
Ulcers.
Yeah.
Okay. All right. Any allergies to latex? I'll correct that in the computer because we have that it can result in hives. So we'll correct that.
Okay.
Any any allergies to latex?
No.
What about any iodine or beta iodine?
No.
Betadine. I'm sorry. And it looks like you haven't had any previous surgeries. Is that correct?
No, I haven't. This will be my first
Okay. I'm gonna take good care of you.
one. Thank you.
And do you have any metal implants? Presence of any metal implants?
No.
Like rods, or have you had a hip replacement or anything like that? Any screws? Okay, good. And it looks like you have had you are on some medications currently, but no prescription medication. So we have the vitamin that you take every morning, the turmeric and ginger tablets, and for herbal supplements, we see that you have an herbal detox drink. Did you say?
Yes.
Okay. Have you taken any of those within the last 24 hours?
No, I haven't.
Okay. And have you had anything to eat or drink after midnight?
No, I haven't.
Okay, great. That's good. I want to make sure you don't have anything to drink or eat. Any open wounds, scratches, or cuts that you are aware of?
No.
Okay, great. All right. And this is, from my understanding, this is the first time you're under anesthesia. Is that correct?
Yes.
Okay. Do you have a family history of anesthesia? Of sensitivity to anesthesia. I'm sorry.
No, I don't.
Okay, good. All right, so you should be fine as well. So how are you feeling about the surgery?
I'm a little nervous, but I heard that the doctor is the best of all time, so that makes me feel better.
Right, Dr. Yeshua, right? Okay, yes. Dr. Yeshua is a really great surgeon. I've worked with him for many years. So you'll be in good hands, and also I'm your circulating nurse, as I mentioned before, and I'll be in that room as well throughout the whole entire surgery, just making sure that everything goes smoothly.
Okay.
And do you have any needs, that cultural or spiritual needs that we can address?
I would like to get with the chaplain if y'all have one and pray.
Okay, before surgery. Okay, we have a chaplain 24/7 on site, so I just will call the chaplain service and see if he or she can come down and see you today. Okay. All right. And is there anything about the surgery that you do not understand that we can clarify for you, or has the doctor pretty much gone over the risks, benefits, and everything with you?
Yeah.
Okay.
It's pretty good.
Okay, good. And do you have any further questions for me?
No, I don't.
Okay.
Thank you.
You're welcome. And it looks like we have obtained your informed consent. It got signed and documented for today. So that's good. And let's see, anything else I need to check for you? Oh, so your clothing, I see that you've removed your clothing. You just have a hospital gown on. That's great. Do you have any dentures or hearing aid?
No.
Okay. And I see you don't have glasses on, but do you have contacts by chance?
No, I don't.
Okay, good. And let me just take do you have any piercings other than
no.
your ears? Okay.
Just the ears.
Okay, and I do notice that you have a watch over here.
Yes.
So we're going to ask you that you please, remove your watch prior to the surgery. We will put it in a safe box for you, and we'll send it to the PACU, which is the post anesthesia care unit. And what they would do is, hold that for you, and then when you wake up, it'll be there for you.
Okay. Thank you.
Oh, you're welcome. Thank you.
And sleeping up.
Yeah, just for your safety. When was the last time you urinated?
This morning.
Okay.
Yeah.
Okay, good. So do you feel like you have to go to the bathroom now at all?
Yeah, I do.
You
I actually do.
Okay. Well, why don't we help assist you to the bathroom? And after that, we'll give a call to the chaplain. And if you don't have any further questions, I will be heading into the OR room, and the operating room. I'm sorry, and we will continue to get the operating room ready for you. That's not completed yet. And then when we're done, we'll come back and get you.
Okay.
But in the meantime, we're gonna get you to the bathroom, and then I'll give a chaplain a call.
great.
All right. Thank you so much, Mrs. Holmes, and I'll see you soon.
All right. See you. Thank you.